All right, welcome. Let's talk about the NCLEX. You know those first action and prioritization questions? Yeah, they can feel like the absolute toughest part of the exam. You're staring at four options that all seem pretty good, but only one is the first thing you have to do. Well, today, we're going to break down the exact way to think, the clinical judgment you need, so you can build that confidence and absolutely nail these questions on the next Gen NCLEX. Okay, let's jump right in.
So here's our game plan. We'll start by talking about what makes these questions so tough. Then, I'm going to give you the exact frameworks you need to think clearly when the pressure is on. After that, we'll walk through a few really high-stakes scenarios together, and we'll wrap it all up with a solid mindset that you can take with you right into the testing center.
So what is it about these first action questions that makes them so tricky? Well, it's not just about what you know, right? It's about making a super critical decision under a ton of pressure. You've got just a little bit of information, the clock is ticking, and a patient's life is literally on the line. It's designed to test your real-world clinical judgment.
Okay, let's just drop you right into the hot seat. Imagine this. You walk into a patient's room, and this is what's happening. Wheezing, that high-pitched stridor sound, hives popping up everywhere. These are all classic, terrifying signs of a massive allergic reaction. What do you do right this second? We're going to circle back to this, but you feel that pulse-pounding moment? Yeah, that's exactly what we're going to get you ready for. Look, the secret here isn't trying to memorize a million different facts. No way. It's all about using powerful mental models, frameworks, that guide your thinking and bring a little order to the chaos. They're basically your clinical compass, pointing you in the right direction when everything feels crazy.
First up, and this is the big one, the ABCs: airway, breathing, circulation. This is your foundation. It's totally non-negotiable. Before you even think about doing anything else, you have to ask, is my patient's airway open? Are they actually moving air? And do they have a good pulse and perfusion? This is the bedrock of keeping your patients safe. And then building right on top of the ABCs, you've got the safety and risk reduction framework. This is where you ask yourself a really simple but powerful question. What's the biggest, most immediate thing that could hurt my patient right this second? Your first action has to be aimed directly at that primary threat. Okay, theory's great, but let's put it into practice. We're going to go back to that first scenario we looked at, that really scary, life-threatening airway emergency.
So here it is again in full. You got to zero in on the key clues here. It's only been 10 minutes since the antibiotics started, and you've got wheezing and stridor. That's a giant red flag for a closing airway. And the urticaria, the hives, just confirms this is a major allergic reaction. This is classic, full-blown anaphylaxis.
Okay, so you see these four options. What's the move? They all sound kind of reasonable, don't they? This is where those frameworks become your best friend. Let's really dig in.
Okay, the only right answer here is number one. And let's be super clear about why. It does two absolutely critical things at the same time. First, you stop the problem, that antibiotic, and second, you treat the life-threatening issue, that closing airway, with epinephrine. Now, what about the others? Applying oxygen is great, but what good is oxygen if the airway is slammed shut? See what I mean? And getting vitals or calling the provider, those are essential things, but they are delays. In a real emergency, you have to act first. And Benadryl, it just works way too slowly and won't open up the airway.
So here's the big takeaway, the thing you have to remember. The trap is picking something that seems helpful, like getting vitals or giving oxygen. For anaphylaxis on the NCLEX, it's a 1-2 punch. Stop the drug, give the epi. That's it, full stop.
Okay, that was a big one. Now let's switch gears a bit. We're going to use the exact same way of thinking, but this time, the main problem isn't the airway. It's going to be circulation and overall patient safety.
I want you to burn this number into your brain. 86/52. This is the big, flashing warning light in our next case.
All right, here's the full scene. Your post-op patient says they're freezing, they've got chills, and look at these vitals. A super high temp, that dangerously low BP we just talked about, a heart rate that's through the roof, and they're breathing fast. This isn't just a fever. This is screaming sepsis. And that blood pressure, that tells you we're tipping into septic shock and circulatory collapse.
So, what are you going to do first? Call rapid response? Get a warm blanket and bump up the fluids? Give something for the fever? Or just chart it and come back in 30 minutes? Really think about it. What tackles the root cause of this whole mess?
The only correct first action here is calling the rapid response team. Hands down. And here's why. Sepsis is a total body crisis. It's not a one-person job. You need a whole team, labs, fluids, antibiotics, maybe even pressors, and you need them now. Calling for help is the fastest way to get that whole machine rolling. The other options are just treating symptoms. A warm blanket is nice, a fever reducer helps a little, but neither of those things is going to save this patient from shock. And waiting 30 minutes, that's just not an option. That's a huge unsafe delay. And this is such a classic NCLEX trap. Don't get sidetracked by trying to make the patient comfortable. When you see those signs of shock, that plummeting blood pressure and skyrocketing heart rate, your number one job is to get help. You call in the cavalry.
Okay, let's do one more of these. Picture this. You just started a blood transfusion. 10 minutes later, your patient gets chills, says their low back hurts, and they're short of breath. These are textbook signs of a hemolytic transfusion reaction, another major life-threatening emergency. So what is your priority action?
So what do? Stop the whole thing, just slow it down and grab some vitals, give some meds, or let it run while you call the doctor. There is only one right answer here, and it is not subtle. Step one, and listen to me here, the only step one, is you stop the transfusion. You have to cut off the source of the problem. Every single drop of that blood is causing more damage. Slowing it down isn't good enough. Calling the provider first isn't good enough. You stop it. Everything else, calling for help, giving meds, monitoring, all of that happens after you've made the patient safe by stopping the blood. So the takeaway could not be more clear. That safety/risk reduction framework is screaming at you. Eliminate the threat. And in this case, the threat is the blood. So you stop it. End of story.
Okay, so we've walked through some really intense scenarios. Airway, circulation, safety. Now let's boil all of this down into a simple, really powerful mindset that you can take with you into the testing center. Think of this as your exam day mental checklist. First thing you do, who's the most unstable patient here? Then mentally run through your ABCs, always. Next, find the single biggest, most immediate safety risk and attack that. And this is huge for the NCLEX. In a real emergency, you act before you do a deep dive assessment. You stabilize first. Then, once things are under control, you can think about less invasive options.
You know, when you strip it all away, it really comes down to one simple question you have to ask yourself for every single scenario. Is my patient stable or are they unstable? Because the answer to that one question tells you everything. It tells you whether you have time to assess or if you need to act right now. If you can master that one distinction, you're going to feel so much more confident walking into that exam. You got this.